In my practice, I come across many patients who are understandably frustrated to learn that there isn't yet a cure-all, FDA-approved golden bullet treatment for their tinnitus. But that shouldn't be a cause for despair, because in recent years, there's been a really exciting surge in funding and research to better understand tinnitus and to find innovative ways to treat it. While fully understanding the potential of these new treatments will require time and extensive research, I feel cautious optimism when I see all the work being done. Today, I wanted to share some of the potential tinnitus treatments that I'm especially excited to learn more about. First up is research looking into treating tinnitus with migraine medications. So many of my tinnitus patients also suffer from migraines. Statistically, this is no surprise. Studies have found that as many as 45% of patients experiencing tinnitus symptoms also experience migraines. This makes sense because the two conditions share some of the same neural pathways and symptom triggers. How it might work: a lot of research has started examining whether targeting the neural pathways causing migraines can also help ease the tinnitus symptoms. This is especially encouraging because there's already many FDA-approved medications for treating migraines. One ongoing University of California Irvine study is investigating the effectiveness of 4 different migraine medications in treating tinnitus symptoms. While it seems to have completed its initial phase of testing at the end of last year, the results are not yet public. So how excited should you be? My Treble Health colleagues and I are very eager to see the results of the latest research because of the noteworthy overlap of tinnitus and migraine symptoms, suggests that migraine-targeted medications could prove very promising in treating tinnitus symptoms. Next up, we have long-term DCS Tendis Treatment. It's a new randomized double-blind study combining electrical stimulation and acoustic stimulation as a double whammy to treat tinnitus symptoms. I want to explain the exciting science behind this, but I think it's really important to understand that no matter how bad your tinnitus is, what its root cause is, or how long you've had it, treatments exist today, and treatments are getting better and better with studies like these. But you can start your tinnitus recovery today. You don't have to wait. I know so many talented audiologists here at Treble Health who can help, and you can schedule a free consultation call by clicking the link above. It's all remote. Again, just all you have to do is just click the link above to get a free consultation to connect with one of our audiologists. All right, so now back to TDCS and how does it work? Transcranial direct current stimulation, or TDCS for short, is a well-established form of non-invasive electrical stimulation of the brain that applies constant weak currents to treat tinnitus. A new study from the University of Zurich proposes coupling TDCS with acoustic stimulation, specifically the use of white noise. The hope is that the combination will be more effective at temporarily suppressing tinnitus symptoms, and in the long term could even reverse the maladaptive neuroplasticity, i.e. the harmful variations in the way your brain's neural networks function that cause the condition in the first place. Previous research has indicated that simultaneous electrical and acoustic stimulation can be more effective than just electrical stimulation on its own. However, this new study's combination of TDCS and white noise is very novel, builds on the brain's strong response to TDCS, which enhances the brain's receptivity to acoustic stimulation. How excited should you be? As I mentioned, there's been some very promising research about the effectiveness of TDCS, indicating that it can reduce neural activity while also treating the symptoms of depression, which often accompany tinnitus for certain patients who have chronic tinnitus or, even sudden onset of tinnitus. TDCS also offers the potential for more user-friendly, potentially outpatient treatment options that could be covered by insurance. The next study is novel sound-based treatment. It's coming out of Toronto Metropolitan University, and the researchers there are examining whether passive sound-based treatment is effective in reducing tinnitus-induced stress and anxiety. The study is going to specifically examine the effectiveness of music-based sound therapy. How it might work is that the participants are going to experience music-based sound therapy via an app for 24 minutes a day for 6 weeks. The control group in the study will be given white noise to listen for a similar duration. The music is intended to mask the symptoms of tinnitus, help patients better manage tinnitus-induced distress, and make them less reactive to stress. Previous research about this kind of treatment for mental health conditions like anxiety has shown and found that music treatment can have a positive effect on the nervous system. The form of music therapy being studied is really interesting because it uses a machine learning algorithm to produce music that starts by matching the patient's current reported mood and then gradually shifts the tonal cues to be more soothing, ideally making the listener feel more relaxed. This approach has been proven by previous research to be effective at reducing patients' tension. So how excited should you be? Here at Treble Health, we use sound therapy, we use tinnitus retraining therapy, and cognitive behavioral therapy approaches to help our patients cope with the stress induced by tinnitus symptoms and their overall perception of tinnitus. It can be very effective, and the simplicity and accessibility of this treatment approach could make it a promising new tool for us. Next up, we have commercial lidocaine patches. What is it? Lidocaine is a type of anesthesia that reduces pain by blocking signals at nerve endings. It can be used in creams, gels, throat sprays, or by injection. In an ongoing study from the University of California, Davis, the researchers are looking at whether or not lidocaine, when being applied via skin patch, can lessen the symptoms of tinnitus. So how might it work? Different kinds of anesthetics have been used to treat tinnitus since the 1930s, so it's been around for a very long time. And lidocaine is currently one of the only pharmacological treatments believed to effectively treat tinnitus. Lidocaine appears to target the central pathways that connect to the cochlear nerve and cause tinnitus. It's currently being used to treat tinnitus intravenously, but with some side effects and risks due to the body's rapid absorption of the anesthesia. The idea with lidocaine patches is to allow for a more steady absorption of the lidocaine over a controlled period of time. How excited should you be? Well, this seems like a promising treatment. Given what we already know about how lidocaine's effectiveness is in treating tinnitus, whether it can work as well when it's applied topically and whether this can eliminate some of the negative side effects remains to be seen. So there you have it. As you can see, there's an exciting and constantly growing field of research in treatments for tinnitus. But that doesn't mean you have to wait for the results to come in to start your tinnitus treatment journey today. Here at Treble Health, our talented team of specialists offer free telehealth consultations to help get you started on a personalized path for treating your tinnitus. To schedule your consultation, all you have to do is just click the link on the screen. You'll receive an assessment of your tinnitus case, a treatment plan tailored to your specific needs, and to ask any questions you may have about your tinnitus to an audiologist. So just click the link on the screen to get started. I see so many patients who with commitment and tenacity are able to make huge strides in treating their tinnitus, and I know that you can too.